Hello and welcome to Budget Day coverage live on India's #1 business channel ET Now. In less than an hour from now, the Finance Minister would be standing on the floor of the Parliament and presenting the first budget of the decade.
I present the budget for the year 2021-2022. To ensure that the economy is given the required push, our BE estimates for expenditure in 21-22 are 34.83 lakh crores.
आज के बजट में आत्मनिर्भरता का विजन भी है और हर नागरिक, हर वर्ग का समावेश भी है।
Good evening and welcome to the India Development Debate. I'm Tamanna Inamdar. So the big budget day has come and gone, a day that we endlessly discuss, especially on business channels, for weeks on end. Has it lived up to expectations? Has it delivered a vaccine for growth? You've possibly heard so much of analysis through the day. Let me just break it down for you very, very simply in 4 or 5 key points. So what was the biggest deal about budget 2021? I would say the top takeaway was transparency that came to the fore. The fiscal deficit figure that India puts out always comes, with people asking if it's just that much. This year, in a COVID-19 year, the finance minister didn't hold back. So the fiscal deficit for this year will be at 9.5%. We do know how deep the hole is. The analysis is that it will be 6.8% for the next year. The FRBM glide path has been set for up to 2025. So it's realistic. Also, the big question about healthcare. Will it get the attention it deserves? And yes, on the face of it, at least it has. At 2.23 lakh crore rupee outlay, the money being allocated for healthcare is up 137%. A clear number for COVID-19 vaccines at 35,000 crore rupees, which is expected to cover a decent amount of the population. Maybe up to 50 to 60 crore people can be vaccinated with that amount. What about taxes? What's in it for the Aam Aadmi is always the question, or the Aam taxpayer. Well, there was no tax relief, but there was no harm done as well. A lot of talk about COVID cess. In an interview to ET Now, Finance Minister Nirmala Sitharaman revealed that she never had an intention in bringing in a COVID cess. But that fear was there, because how are you going to finance all these big spends in a post-pandemic year? So we have been spared any additional taxes as of now, which is important when people are still reeling from reduced incomes. Then where is the money going to come from? And here there is a very clear plan for disinvestment, no shying away from even using the word privatization or pushing forth on it to public sector banks, and one general insurance company is aimed to be privatized this year. The disinvestment target is also more realistic and reduced 1.75 lakh crore rupees. Little surprise then that markets gave this budget a massive thumbs up. Rock and roll all the way. The Sensex zooming over 2,000 points to 2,315 points to be exact, to 48,600. So let's break down the budget further. What do our top panelists think about it? On the show today, you will hear from Amitabh Kant, CEO of the Niti Aayog, who has also been tasked with preparing a fresh list of candidates for privatization. Vipul Jhaveri, Managing Partner Tax at Deloitte India, will be joining us on the show to find out all the devil in the details. Uday Shankar, President FICCI, will be giving us the corporate outlook. I will also be speaking with William Foster, Vice President and Senior Credit Officer, Sovereign Risk at Moody's. Investors will also be joining us today on the show. Kiran Mazumdar Shaw and Dr. Ashutosh Raghuvanshi will break down the details of the health budget this year. So let's get straight to it. Let me go across first to Amitabh Kant. Mr. Kant, is this budget really been able to deliver on what was expected? It was supposed to be a never seen before budget. Has it been or done enough to really rev up the engines in a post-pandemic year?
First and foremost, this is firstly a budget which doesn't look at merely, accelerating growth for this year. This is not a budget for this financial year, but it's actually a budget for the next 4 to 5 years, because it lays down really the key principles within which government will operate, and that is that it continues the process of disinvestment. It lays a huge focus on monetization. It talks about opening up FDI in insurance. It cuts down, it talks about banks getting privatized, insurance companies getting privatized, and therefore it lays a very clear trajectory. And secondly, it doesn't distort anything. And what is very important in a COVID year is for a budget not to do anything damaging. So it's a very pragmatic, it's a very practical, it's a very rational budget, because it doesn't put in additional cesses, it doesn't put in additional taxes, brings sensibility to the budget making process. And thirdly, I think on the tax side, by doing away with anti-dumping duties and by doing away with distortions on raw material and intermediate goods, it will make goods cheaper for the MSMEs. It will make raw material and intermediates extremely cheap, and that will benefit MSMEs in a very big way, and eventually end up creating employment in the country. But my big thing about the budget is that it really focuses heavily on infrastructure. The capital expenditure goes up by 34-35%, but it talks at length on infrastructure. And my belief is that infrastructure is really the way forward. And secondly, because private sector investment is still shy, pushing out brownfield investments and privatizing them across rail, across roads, across warehouses, across sports stadiums, across warehouse, all this will bring in private sector, and they in turn will bring in debt along with them. And that is the best way to kickstart really in for accelerated growth in the coming years.
In fact, we ask about the boost to private sector investment in our interview to the Finance Minister Nirmala Sitharaman as well. Quick programming reminder ahead in this show, you're going to watch a substantial excerpt of that interview coming up. Don't miss it. But meanwhile, Mr. Kant, I want to speak to you specifically about disinvestment. The Niti Aayog has been pushing for it. You've been tasked with preparing a fresh list of candidates for disinvestment among central public sector enterprises. Tell me about the target for this year at 1.75 lakh crores, less than last year's of 2.1 lakh crore rupees. Is it more realistic, and which are the fresh names on your list?
So that bit of homework will be done by Niti, but broadly on the strategic sector side, there are 4 strategic areas which will remain. The government's objective is that atomic energy, space and defense, transport and telecom, power, petroleum, coal and mining, and banking, insurance and financial services are 4 strategic sectors in which there should be 3 to 4 public sectors, either by amalgamating or by keeping just 3 or 4. But in all other areas, government should get out of businesses, and all other areas we should not have public sector. So we will get down to this business of making specific recommendations as early as possible. We've done our homework, and you'll have a fairly quick roadmap from us. As you are aware, we've not been shy of this. We've made a huge number of recommendations on the disinvestment, and a large number of public sector companies are actually presently undergoing that process of are at a very advanced stage of disinvestment.
The problem with the disinvestment program in India is I wouldn't say it's lack of will or lack of ideas or lack of recommendations. Frankly, it's about actually getting it done. So even with the 2.1 lakh crore rupee target last year, and yes, of course, COVID-19 happened and all of that. But what do you think are the very systemic challenges for the disinvestment program. For example, you had markets zooming all of last year. Why didn't we leverage that, and how do we ensure those issues don't persist?
First is, I think I've been discussing this with Secretary Deepam, and his view was that, one must be very clear that, that we've been through this process of COVID, the process of disinvesting government assets. You need to go through processes, you need to go through several committees, you need to, you are selling companies, large companies, like you're selling BPCL, you're selling Concor, you're selling Air India. If you mess up on the processes, and that is where in government we tend to make mistakes, and then you get a lot of allegations and criticism on a later date, and therefore it's very important in government that you go through these processes rightly. But now that the processes have been laid down very clearly, we should accelerate the process.
What about this year? Is it feasible to expect Air India, for example, to be disinvested this year, considering the kind of battering that entire sector, the aviation sector, has taken post-COVID-19?
Yeah, not only Air India, but also BPCL, also Concor, also BML. All these should be done with during this course of the present financial year. There's no doubt about it. And to my mind, the target of 1,70,000 crores is very much achievable and very much doable.
All right, let me go across to Vipul Jhaveri. Vipul, when we look at the budget document and the speech, on the face of it, things seem very positive, but you really are the person who ekes out all the devil in the details. So tell us, in terms of compliance, in terms of tax compliance, have things really been made easier as the claim is?
Yeah, there are several changes that have been made that do make the compliance burden easier. For example, for senior citizens, that no need for filing if you have only a couple of types of income, which is pension and bank interest. You could also be exempted from getting your tax audit done if your turnover is below a certain threshold now of 10 crores. So there are certainly several provisions which do take away the burden of compliance materially. Having said that, there are a couple of provisions also that have slipped in, which I believe would increase the compliance burden. For example, a TDS of 0.1% has been introduced on purchase of goods over 50 lakh. This would mean that every purchase that anyone makes above 50 lakh, the purchaser would have to do a withholding tax on that, and that certainly it's not just about withholding the tax, it's also depositing, and then there would be returns to be submitted in relation to that. Another provision that has come as a bit of a surprise is TDS on non-filers. So what it really is that until now we had a provision where if a certain PAN was not submitted by the buyer, then the tax rate would be higher, TDS rate would be higher. Now they have introduced a new provision in addition to this one, that not only must the PAN not be available, but if the person has not filed his return for the previous 2 years, then also a higher rate of tax would be applicable. Now, this does cast a huge responsibility on the buyer of the goods or services that to verify filing of the return, which also leads to certain other sensitive aspects that means the the counterparty has to provide, I guess, an acknowledgement which would disclose what is the income that they are earning. So I think there are a couple of the such provisions which I would rather that they were not there.
You know, Mr. Jhaveri, overall, if I were to ask you big picture, because in every budget we hear this claim that compliances are improving. You are bringing in things like faceless assessment. Now there is an increase in the ceiling for audit, etc. Is that really the experience on ground with the tax department for companies? For corporate tax, has it actually eased over the years, and what else do you think needs to be addressed more urgently?
So compliance is certainly, a big burden on any taxpayer, and particularly the large taxpayer with the large number of compliances, whether on account of direct tax or indirect tax, they have increased over the years. But again, I think with the increased, transformation of the businesses in form of digitization, I think that, directionally, these compliances are becoming so standardized and automated that in a matter of years, I think these should be far more easy to comply with. We've also heard the finance minister talk about pre-populated returns. So they will only improve in quality and data over a period of time. So it's not something that will happen overnight, but it's a journey. And I think with lots of, such digitization initiatives, the audits also will reduce. The kind of inquiries in the audits which were made in a traditional way will change. So in a manner of speaking, I think, this is a learning curve for everyone. The taxpayer as also the revenue authorities. And for a change, I must say that the revenue authorities are ahead of this curve on the digitization front. They are really, investing a huge amount of effort on this. And it is the taxpayer, if and when they come up to speed, I think the compliances will become much easier. Of course, the rigor of the compliances will become harder because the audits will be based on specific information, specific analysis, and the risk assessment procedures that the revenue will adopt. And therefore, the rigor of those few assessments would be high.
Mr. Jhaveri, if I were to ask you a little forward-looking, especially in terms of smaller companies which do not have the bandwidth to go in for mega compliances, has the tax regime in terms of ease of doing business actually improved over the last few years as has been claimed?
It's a mixed answer, honestly. I mean, there are, for example, the interaction with the revenue authorities has increased dramatically. A lot of faceless assessments, filing, that takes away a lot of sting of the compliances which, I have seen in the earlier years. Likewise, the refunds are processed so rapidly today. And we've also seen the change in the provision where the time limit for completing the assessments is also further reduced by 3 months. So all of these things do go to ease the burden of compliance. The appeals now, again, with a lot of e-hearings that are happening, not just before the Commissioner appeals, which is the first level of appeals, but it is also proposed now that the tribunal will hear, in a small way it has already started, but now it will become far more formalized. And with the introduction of the new provision where the committee of disputes will look after the disputes of the small taxpayers, I think that also will further, ease the burden of compliance and the struggle with which the small businesses have been faced with for a long time.
Right. I want to now turn attention to the big macro numbers which came out of them. And William Foster joins us from Moody's. William, great to have you on the show on Budget Day. Always keen to know what Moody's is thinking of the budget. And I was reading your note from earlier where there was some concern regarding the extent to which the revenues and the tax revenues which have been forecasted could actually be achieved. Tell us, is the 9.5% fiscal deficit number worrying you today?
Well, 9.5 really reflects an extraordinarily bad year for the global economy, for India. So the headline number, yes, it's greater than we anticipated. But I think what's really important is looking forward, what the roadmap is, and most importantly, and this applies to revenues, is how strong can growth be moving forward in terms of what measures can the government put forward to ensure that you have a strong recovery that's sustainable, and that will then feed into revenue buoyancy and the capacity to raise revenues through taxes and GST and just through improved economic activity. That's really the big question moving forward. And I think the focus that the budget has had on growth, on things like infrastructure, on trying to address the bottlenecks in the financial system, and of course, most importantly, the health response to make sure that the people of India and that the economy can get out of this health emergency as quickly as possible and as safely as possible to get the economy back to a normal track will be critical for revenues. And I think it is encouraging on that front.
From your perspective, William, for how long does India and other countries of the world get a quote-unquote free pass post-COVID-19? Obviously, COVID-19 has upended everyone's calculations. So will agencies like yourself go easy, putting it very simply, on sovereign ratings for some time?
Well, I just want to be clear. I mean, what's most important in terms of our approach to sovereign ratings, our methodology is very transparent about how we approach this and standardized across all countries, is, certain countries were more vulnerable coming into this shock than others. And I would identify India as one of those countries because we were very clear before the pandemic hit in December of 2019. We had flagged some of the challenges that we had seen with a constant slowdown in growth in recent years that was potentially going to be appeared to be more structural than cyclical in nature, signaling potentially lower potential growth in the future. Ongoing challenges in the financial system that had expanded outside of the public sector banks into the non-bank financials, and ultimately there was the challenge with Yes Bank, a private sector bank, and that really spilled over into the fiscal challenges, which for India is the most acute given its very high relative debt burden to the peer group. But that said, this is an extraordinary year. So the countries that were hit hardest really are those that had the least capacity to respond with counter-fiscal fiscal policy and extraordinary monetary policy to try to cushion the blow to the economy. That has had different rating impacts on different countries around the world. I think India was, like we said, more vulnerable going into this. But fundamentally, the question is moving forward, what will the growth path look like for India? Can it get to something similar to the pre-COVID place that we had been, at least prior to the very significant slowdown in 2019, that would then be able to feed into a stronger fiscal consolidation path, reducing deficits, reducing that debt level over time that could create fiscal space for the economy. Those are the questions that we have right now. And so we're looking forward, not backward at this stage.
Fair enough. Now, in that context, the IMF recently, and we had an interview with the chief economist, and she says that it will be possibly up to 2025 when India returns to pre-COVID-19 growth levels. Is that on par with what we're seeing around the world? Does that pace worry you? And do you have any take at all on the pace and quality of recovery we've seen over the last 6 odd months in the Indian economy?
That's really the big question all around the world, is how quickly can economies emerge without permanent scarring, permanent damage to the employment levels, destruction of businesses, bankruptcies, and that's where government support really comes in. We're seeing varied recoveries around the world at different paces, and so it's really you can't apply a uniform rule. I would say what's very encouraging with regards to India right now is the pace of the vaccinations, as well as the daily occurrences of daily incidences of death and of people getting COVID right now has really come down substantially since September, obviously, and that's not the pace that you're seeing around the world. So first and foremost, for economies to emerge from this crisis in a sustainable way, the health crisis needs to be dealt with. So with regards to India, that is starting to look more and more encouraging. The question then is, what are the permanent measures put in place or reforms or just general business conditions that can crowd in private investment, along with benefiting from government support that eventually can be phased out over time, to allow for sustainable recovery in jobs and in economic activity. And that's the open question all around the world. That's still an open question with regards to India. I think the challenge with India, as I said, is really that the economy and growth dynamics were slowing before COVID. And so there's that element that needs to be dealt with on a structural level, in addition to this shock from COVID. So that that's the question moving forward, is to what measures can be put in place, to what extent can that be dealt with in a meaningful way that will bring the growth rates back up to pre-COVID. But of course, pre-COVID real GDP was 4.2%. We're talking, I think, prior to that, when we had more regular average real GDP growth rates around 7%, or certainly between 6 and 7%. Can India get there? It's going to take time. It's going to take, meaningful strong implementation is another challenge, not just the announcement of reforms, but the effective implementation of them, and a renewed confidence by the private sector to invest more, with support from a financial system that can provide that credit. And that's clearly a work in progress right now.
Absolutely. Thank you so much for that, William Foster. And in fact, has the private sector felt that kind of confidence building, that enthusiasm going in? And you've heard from the biggest corporate voices of the day, all through the day. In fact, I'm joined now by FICCI President Uday Shankar for more on that. Uday, the budget was expected to deliver never seen before impetus. Do you think it has ticked the box on that score, especially when it comes to the private sector?
I think the budget has a lot to boost private investment in the post-pandemic world. I think the most important thing was to bring confidence back into the economy, and to bring confidence back that the government was really serious about putting the economy back on the track and bringing the growth focus sharply on the national agenda. And I think the budget has done that exceptionally well. I've said this, that in the morning when we woke up, we were all hoping that it would be a great budget the finance minister had promised, but each one of us was afraid that it might disappoint us. This time, on the contrary, it has taken us all by surprise, a very, very pleasant surprise. And I think it is primarily on account of the fact that there is not a lot of tokenism in the budget. It's a simple budget. It's very straightforward. It's very transparent. It has, the finance minister, it seems, had identified the areas of priority for the government, which is to, revive the economy, give a fillip to investment and jobs. And she understood that she wanted to do it through reviving investment in infrastructure. And that's a massive push to infrastructure in the budget. Social infrastructure was required. The government felt the need for it. Healthcare, education. And again, we've seen healthcare infrastructure development getting a massive push in it. The government wanted to simplify and create inviting regime for foreign portfolio investor and financial investors. And we see some very, very clear steps there that should help them. The simplification of the tax process on REIT and InvIT, very, very good move. And above all, government has acknowledged very clearly that they want to do these things, but they don't have the resources. And instead of beating about the bush, they've been very direct and forthright by saying, we will privatize. Whatever is unfinished agenda in privatization, we would do that. But something unprecedented we are seeing is the statement to privatize 2 public sector banks and 1 insurance company. That's never been done. Given all the controversies and political issues that are going around right now, one was afraid that the government might have chosen to play it safe. Instead, they have stepped forward and, as we say in cricket, played it on the front foot.
Yeah, I mean, even insurance limits and FDI and insurance being increased to 74%. So yes, some bold moves there. But Uday, some people would argue that has enough been done for MSMEs? There have been schemes which have been announced in the past of the last year, in the course of that year, but MSMEs are still hurting. Do you think there was more scope there?
Look, I think the route in the budget is very clear that it is not, it is not targeting any specific sector. It's targeting the primary drivers of the economy, which is to, invest in infrastructure and create the downstream cascading effect where, the MSMEs, the corporate sector, private enterprise and jobs, they all benefit from that. So the thesis in the budget is very clear. So I think it would be a mistake to see this, what is in it for this sector versus that sector. They've just targeted primary, fundamental areas that will spur the economy and make it grow faster.
All right, thank you so much for that. Uday Shankar there, William Foster, Amitabh Kant and Vipul Jhaveri for bringing this entire budget and analyzing it for us. We're going to focus a little more on the healthcare aspect up ahead. But before that, let me just take you through some interesting trivia about the budget. Did you know that this is Finance Minister Nirmala Sitharaman's shortest speech yet? Since her first one in July of 2019. The budget this time also went completely digital. Instead of the Bahi Khata, it was replaced by a tablet, and a Made in India tablet at that. The markets loved this budget. The benchmarks posted their best budget day since at least the start of this century. So that's a big one. And they've posted the second best point gain in history after 7th of April 2020. We've also put together some interesting data from the budget speech. So the number of times the word infrastructure featured in the speech was 57 times, income 52 times, exempt was 47 times, health was 34 times, scheme was 34 times, benefit 23 times, reduce 20 times, agriculture 19 times, affordable was 17 times, Atmanirbhar was 13 times, I thought it would be more, reforms were 12 times, include was 12 times, economy, give and people was 11 times. We've excluded tax and reform because I think that would be a big number. So a lot of exciting trivia there coming in from the budget. Here on the India Development Debate, we have been focusing on the healthcare aspect for Budget 2021. Typically, India allocates just about 1% of its GDP on its budget. And clearly, in a post-pandemic year with COVID-19, the stress and importance that healthcare needs cannot be explained enough. So has the Finance Minister done justice? On the face of it, it seems so. At 2.32 lakh crore rupees, it's a 137% jump in allocation in the budget for healthcare. There's been an increase outlay for things like sanitization as well. Another 35,000 crore rupees has been allocated for vaccine rollout, and a new scheme has been announced called the Prime Minister's Swasthya Bharat Yojana, which will have an allocation of about 64,000 crore rupees, but that's over the next 6 years. So net, have we done enough in this budget for a healthier India? To speak on this, I'm joined now by Kiran Mazumdar Shaw, Executive Chairperson at Biocon, and Dr. Ashutosh Raghuvanshi, CEO and MD at Fortis Healthcare Limited. Welcome to both of you, and thank you so much for speaking with us. Kiran, let me start by getting your take. Apart from the big number that we see up ahead, would you say it's ticked all the boxes in balancing, on the one hand, a strengthening of India's basic healthcare infrastructure and enough of a focus for the pandemic?
So Tamanna, let me start by saying that, it is directionally very positive for the healthcare sector. I think, the COVID spend of 35,000 crores is extremely vital for the, for dealing with the pandemic. And the increased spend on beefing up the primary, secondary and tertiary infrastructure in healthcare is also extremely important. So together it's about 100,000 crores. And as you rightly said, the 64,000 crores is to be spent over 6 years. But regardless of that, I believe that this is an amount that is an indicator of how much extra is now going to be the new normal. If we want to get to 2.5% of GDP over the next 3 to 4 years, then we have to minimum spend this kind of money, and this is the right start. Now, after COVID, we need to use the same 35,000 crores for other diseases. I think we have a huge disease burden, which today is not really the center of attention. But post-COVID, you will have to deal with both communicable and non-communicable diseases, TB, other viral diseases, dengue, chikungunya, etc., plus diabetes, plus cancer. And you have, and you really need to spend that kind of money. And then over and above that, I think the healthcare sector affords a huge job creation opportunity. So as you beef up your public health ecosystem, I think you can create a large number of jobs in the allied, health ecosystem, healthcare workers ecosystem, starting with ASHA workers, Anganwadi workers, nursing, paramedics, you name it. I mean, as you expand the healthcare ecosystem, you need to also find the human capital to staff it with. So that's going to be a big opportunity. And then I'm glad to see that the government has invested in research and innovation in the public health, research ecosystem. But there I hope that the private sector is going to be an integral part as a beneficiary of that research spend. Because unless you have a strong industry academic research partnership, this money will not be well spent. So again, when it comes to the healthcare system as well, I think private sector also needs to be a participant in benefiting from this spend on healthcare.
I want to focus a little more on the vaccine rollout. And Dr. Raghuvanshi, let me come to you on this. So at 35,000 crore rupees for vaccine rollout, if you do a back of the envelope calculation, and we heard the secretary say that this is about 600 rupees per head, including 2 shots at 200 rupees, and then, ancillary charges, etc., administration, transport. So that works out to 58 crore Indians that can be vaccinated with this 35,000 crore rupees. If I very simply assume that this will go completely just for vaccination, does it then seem that a large part of this population will be vaccinated by the government free of cost?
Yeah, I think that's the approach government has taken for now. But I think my view is that the government alone may not be able to vaccinate sufficient number of people. And there are many people in the country who would be able to afford the vaccination. So I think once the vulnerable segments of populations have been covered by the government initiative, I think this program should be opened wide so that more number of people can access the vaccination and pay for it. That way, a larger population, vulnerable population in the rural areas, etc., also will be able to get the free vaccine. So giving free to everybody is probably not going to be a very effective strategy.
Dr. Raghuvanshi, just your overall comment on the budget and the amount of outlay that we've seen. We had an opportunity to discuss even last week what you would expect from the budget as a frontline healthcare worker as well. Do you hope that enough of this fund that has been allocated actually goes into strengthening the basic infrastructure?
So directionally, I would say this is very encouraging. First of all, the fact that healthcare has been put as one of the 6 focus areas, I think that is long overdue. Now, there is so much of inadequacy of infrastructure that whatever amounts are invested in it is probably not going to be sufficient. But directionally, it appears that we are going in the right direction, as Kiran said. And I think that momentum will have to be maintained. So this is certainly better than what we were doing earlier. And if we maintain this momentum, that will be helpful. Now, say 64,180 crores, which has been given for the purpose of this program, which lasts for 6 years. Over 6 years, that is not enough capital to build the kind of infrastructure which is required. Now, if we do a back of the envelope kind of calculation, one of the announcements is that 602 critical care blocks to be constructed in district hospitals. Very good step. First time tertiary care is being put into focus, and it is important that every element of the healthcare ecosystem is taken care of. So, but if you look at the amount of expense which would be required for that, probably this amount will just go into that. So a persistent and sustained, outlay, for example, once the pandemic is over, this 35,000 crores and similar amounts, or maybe even more than that, would be required to create adequate infrastructure. The other thing which is very heartening in this particular budget is that for the first time, the human resources related issues have been addressed. The Nursing Commission, the Allied Healthcare Professionals Commission, which has been mentioned, I think that is going to make a huge difference. And as Kiran said, that healthcare is one of the biggest employers. It has a huge health potential to generate more employment. And we have had shortages of these manpowers in the country. So I think this issue being addressed, I think is a very significant development in my mind.
The other real big question, Kiran, is how we actually disburse these amounts. Governments and all governments are notorious for allocating budgets for various, heads, but not really ending up spending that money or not spending it efficiently enough. Do you think that that's the big question mark when it comes to healthcare?
So these two, buckets that we have just heard about or are discussing, now spending 35,000 crores on a vaccination deployment definitely can be done. But I agree with Dr. Raghuvanshi that the private sector has to be roped in. Otherwise, you're not going to get the speed and scale. And I really worry that we are not a country that has a shortage of vaccines. We have adequacy of vaccines. We shouldn't let the vaccines remain in warehouses. We need to get them out and vaccinate people as fast as possible. And we know that if you just rely on the government ecosystem to vaccinate people, you're not going to be able to do it fast enough and at the scale you want. Private sector has to really play a big role in this. I completely agree with Raghuvanshi that why should everyone get a free vaccine? I think most, of the middle class population can afford a vaccine. And I think we need to use, in the US, for instance, they have just started employer-based distribution of vaccines. We need to do the same. Corporates, employers who want to vaccinate their employees ought to be able to procure vaccines. And this can easily be done. You just need to put an MRP on vaccines and have a database on which you upload the number of people you're vaccinating. We did the same in the case of RT-PCR testing and did it very well, because without the private sector, you would not have been able to test at this scale and at such speed. And we've done extremely well globally. So I think India's private sector is very capable of vaccine deployment at both speed and scale. And that's what I hope the government will do sooner than later, because we must use our capacities optimally. We really don't want to just keep it in warehouses or just keep exporting it because we can't vaccinate our people fast enough. So that's my request to the government. And in addition to that, I think, this amount that we've allocated can be spent at least this year. It's not very difficult to spend 10,000 crores on beefing up some of those infrastructure needs in the healthcare sector. And it's not difficult to procure vaccines and deploy them. So I don't think we have a problem here. But I think going forward, you're right. I mean, in every sector, we've always fallen way short of the allocated amount because we just don't have the spending capacity. So we need to be very aware. And I'm sure we can look at it. But healthcare is one sector that I'm sure if you do it well, there's not enough, that can be invested.
I'm just glad that the finance minister started her speech and the first big item she addressed was healthcare. And that is crucial. I think another aspect that we have to see how much we can push upon on a policy initiative is widening the coverage of health insurance so that out-of-pocket spends for the average Indian go down and a serious disease does not impoverish an entire family. But for today, we can say it's a good day for healthcare in India. At least it's getting the attention it deserves at the very least. Thank you so much, Kiran Mazumdar Shaw and Dr. Ashutosh Raghuvanshi, for joining us on this aspect of the show.
Thank you.